Hello, everybody. My name is Mason Watt. I'm currently living in Bountiful, Utah, and my question for the In-Vivo assignment was essentially that my 80-year-old grandmother who lives alone is now not able to care for herself and thus needs to look into some in-home care options. So, the scenario is actually really applicable to my life situation. My mother-in-law has been caring for her mother for a couple years now, kind of in the same situation where a couple times a week she would need to go down and care for her. But it's kind of getting to the point now after a few falls and some other health issues that she needed more care than what she's currently being given. And my mother-in-law lives about 45 minutes to an hour away from her mother, and so it's becoming to a point where they have been looking to in-home options. And so in that process, I was able to participate in that and look at a few of the quotes and companies they were looking at. So just give you a brief rundown of what in-home care is. I'm sure most of you are aware, but in-home care is essentially where a nurse is able to come and take care for the individual in their own home. Prices vary considerably. One of the more expensive ones we found was for about $26 an hour. But the company that we found we were to go with, we ultimately decided not to do in-home care because of the price. My grandmother essentially needs care through the evening, and so she needs help going to the restroom usually 3 to 4 times in the evening. And so ultimately she needs somebody there to be able to provide care for her. And so some of the things that we've looked at as options is to have a nurse be there 24 hours a day. And obviously it's a rotating shift. So every 8 hours there'd be a new nurse there. But that was going to cost $17 per hour. So if you times that by 17 an hour times 24 hours times 30 days, the total cost was going to be about $12,600 per month, which obviously for an 88-year-old woman is a considerably high price, especially when you look at, nursing facilities are about at the low end are about $3,500 and the high end is about $5,500 per month. And so it just wasn't a very viable option. But the company, so anyways, this quote that I got was from First Choice Home Health and Hospice. They're located about 5 to 7 miles north of where we live in Layton, Utah. So anyways, I guess that was an option. Another option was to pay about $23 an hour and have somebody there for 2 separate 3-hour increments during the day. One kind of in the morning to help prep, get her ready for the day, feed her breakfast, prepare lunch. And then someone also come in the evening to help her go to the restroom, give her medication, things like that, and then probably be there for one more restroom visit. And then so that was another option, but I mean, even at that price, it was quite a bit higher. It was in the $8,000 to $9,000 range per month, which was still almost double from a nursing home. And so obviously cost varies based off of the needs of the individual. If someone just needs help making breakfast, taking their meds, and getting dressed, it's going to be a lot more affordable than somebody who has to have round-the-clock care, as we mentioned, with having someone to have to be there to go to the bathroom every time, to be able to get out of bed, to move anywhere in the house. So essentially, I think where the best education can come, Marty was going to talk to you briefly about the training and kind of long-term care insurance, but I wanted to talk to you about the restrictions for Medicare to pay for home care. And so in an article that I found by the American Cancer Society, they published an article that mentions kind of the process of getting approved to have Medicare pay for in-home care. And just for your information, in 2015, Medicare paid for 35% of in-home care, Medicaid paid for about 32%, and then private insurance paid for about 10%. So between the three of those, that covers about 80% of individuals who receive home care. It's paid for by those three different payers. It's kind of a process to be accepted by Medicare. This article by the American Cancer Society says that to be able to have Medicare pay for in-home care, you must have a physician say that deem you as a medical necessity for you to have it at home, as well as you have to be either a full-time or part-time recipient of skilled nursing care, physical therapy, speech and language therapy, or occupational therapy. So any one of those you have to have at least part-time. And then the other restriction is that you have to be homebound and unable to leave your home without assistance. So you can't be able to leave your house on your own. There's a few restrictions, a few exceptions to that for like haircuts or religious services. If you're able to leave the home for those things on your own, then typically you're not going to be disqualified. Medicaid obviously is dependent on the state, kind of what their restrictions are, but a lot of times people who are receiving Social Security will also qualify for Medicare in most cases. The VA, the Department of Veterans Affairs also can cover some in-home care, but the VA themselves typically does not provide the service. They outsource it and just pay for it. But then obviously some private insurance companies do have provisions that can cover long-term care, but a good majority of them do not cover that as a full-time basis. Some just would pay for a very short-term needs, 10 days or less typically. And then a lot of it's done by private pay. About another 8.5% to 10%, depending on the year, was done by private pay, and so that's also something that's done largely as well. I guess to wrap it up, the advice I would give to somebody who's looking for in-home care, I would say look into kind of the qualifications of the nurses, because depending on the nurse, sometimes it's a CNA, sometimes it's an LPN, and then sometimes, in some rare cases, you can get scheduled to have a registered nurse come. And obviously you'll pay for the difference in that, but a lot of home health places also do not, a lot of in-home places don't do certain types. Like we were drawn to First Choice because they provide cardiac care and hospice and IV therapy if it becomes that bad. And so anyways, that was attractive to us. But anyway, so look into your specific needs. Costs are important. But if it's done right, home care can be one of the most affordable ways to do long-term care. But on the other spectrum, it can be probably the most expensive way to provide long-term care. So anyways, hope this was educational. Appreciate your time for listening. Thanks for your comments. We'll try to respond to you best we can. Thank you. Bye.